Now, tuberculosis remains one of the leading causes of deaths worldwide, even higher than HIV/AIDS. So what has happened to TB patients, particularly now during the coronavirus pandemic? In South Africa, fewer people were tested or treated for TB last year during the hard lockdown. This means that more cases went untreated and undetected. A World Health Organization report has found that the COVID-19 pandemic has set progress towards ending the disease back by a decade. Now, that's a significant impact. For more on this, I'm joined via Skype this lunchtime by Professor Keertan Dheda, head of the Division of Pulmonology at the University of Cape Town. Prof, good afternoon. Thank you very much for joining us this lunchtime on eNCA. I mean, the tragedy around a disease like TB is that it's been with us for many, many years. It is a curable disease. It is a preventable disease, as the Minister of Health, Dr. Zweli Mkhize, just reminded us when he was addressing a World TB Day meeting that we brought live earlier to our viewers. But now with the COVID-19 pandemic, things have got really worse for TB sufferers. Am I wrong?
You are correct, and essentially the COVID pandemic has resulted in the taking away of attention or resources from a lot of other diseases, and TB is one of them. And as you correctly outlined, and as the Minister outlined, and many people have outlined, it is the commonest cause of death in the country. And so we really need to be very concerned about that. And on average, last year, the case detection dropped by about 30%. Now, this is not a problem that's unique to South Africa. It's a huge problem in India and in China. And it's been estimated that last year, with the reduced detection of TB due to COVID, and hence reduced treatment and diagnosis, basically that translates into a very scary number of an estimated additional 200,000 deaths for 2020 due to TB. And, that takes us back in TB control about 5 to 10 years. So it is a very concerning situation. And the big question is, what are we going to do about it? So that is very concerning.
Yeah, but now, what could it be? Because, I mean, we just saw the prevalence statistics that were issued last month, I think, or earlier, by the Department of Health, showing that actually the levels of prevalence of TB in certain parts of our population are actually higher than originally thought.
Yes, I think what you're referring to is the National TB Survey, which was undertaken from 2017 to 2019. And what that essentially showed in 2018, we actually had underestimated the number of TB cases in the country by about 60,000 cases. And what that really means is that number one, we have a very high burden of TB. And all credit to the Department of Health. They've rolled out a number of new interventions. I mean, if it wasn't for that, our TB numbers would be even higher. For example, we're one of the few countries in the world where where one can walk into any clinic and get access to a frontline sophisticated DNA-based diagnostic test called Gene Expert. They've rolled out TB preventative therapy, brought in new drugs like bedaquiline, but a lot more needs to be done. And the reason is not only because of the increased suffering and very high death rates, but this also has a massive impact on our GDP. And it's estimated that this sets back our GDP by between 2 and 3%, which equates to roughly about between about 150 and 200 billion rand a year. So it's a no-brainer that we need to invest more in TB resources. A lot has been done, but we need to do a lot more. And one of the things I think that is very important to mention at this juncture is that we really need to rethink our public health strategy for TB. At the moment, we rely on patients to self-report and present to our clinics. And what the survey showed, in fact, that over half the TB was actually in people who had minimal or no symptoms and who were at home, because this was a door-to-door survey, right? So,
yes.
And our research has shown that about a third of these patients, you may argue that, they have very mild disease, and that's probably why they're at home. In fact, in a third of them, they actually have very high concentrations of bugs in the sputum, which we verified in a study published in Nature Medicine last year. And so it means that unless we go out and detect these cases, we're going to have the same spiral. We're never going to get TB under control.
Yeah, does this make a case for the current debate that's been going on as we conclude, Prof, that we might need universal testing and a treatment approach? I mean, the minister a short while ago, Dr. Zelimkhize, saying that we need to do more testing and treatment. Should South Africa adopt universal testing for TB?
I think that's an excellent idea, and I fully endorse it. And I think to add a little bit more detail to that, it also, you can only test once you find cases to test. So I'm talking about, extending our TB strategy or radically changing it. So we actually leave the clinic and we take the diagnostics out into the community. And that can be done in a number of ways. One could use apps, for example, that worked very well for COVID. One could send healthcare workers out into the community, and that's being done in some parts of the Western Cape. And also more innovative strategies where we can have mini mobile clinics where these diagnostics now have reached a point in terms of technology development where they are now available, they're battery operated. So, previously we couldn't do this, but we now have tools where we can take these interventions out into the community. And we've just finished a large study which showed, in fact, that it's feasible and it's practical to do these type of things. So it's not going to be one silver bullet, but we need a lot of different strategies which actually move diagnostics and case finding out of the clinic. We need to move away from passive detection to actually taking this out actively into the community.
Yeah, so there is some hope, at least if the strategy changes and we adopt certain measures like universal testing. Thank you very much, Professor Keertan Dheda, head of the Division of Pulmonology at UCT.